night's edition of MPH Talk. Tonight we're going to talk about the recession and whether health is really recession-proof. With us in the studio is Daniel Jafari, a health systems expert from Iran, Neo, a market analyst from Cyprus, Xiaojing, Chief Executive of Sacred Heart Private Healthcare Insurance, and from SEMA, a special report from the WHO Collaborative Centre. So Dan, what impact would you say the recession has had on healthcare in the UK?
Well, you might think that it would have little, as there's a government-run National Health Service, but it is having an impact. The effect of the recent downturn may not be hitting the NHS just yet, but it soon will. In the 5 years from 2011, the combination of rising costs, lower increases in the budget, and the impact of the recession will mean that the NHS will face a real-term shortfall of £15 billion. Considering the fact that the UK health system model relies on fixing of the supply of the healthcare system by policy-making process, the ever-increasing gap between supply and unmet demand for medical care widens. These budget cuts will impact the services that the NHS can provide and the supply of the healthcare to the British people.
Would you say then that health is recession-proof?
Well, the recession affects different countries depending on the health system they have in place. While the UK may be affected by budget cuts, the American health system will be more widely affected. The demand of healthcare by the population and the supply of healthcare and the provision of insurance will all be affected. Biotechs and pharma industry have a constant market demand, which means there is no elasticity on demand curve, since new drugs are always sought after. But Kate, contrary to common belief, the health sector is not so recession-proof. This is especially true with the primary care in the US. When the recent global recession was in full swing, many insurers refused to or decreased the reimbursements on expensive procedures, thereby depriving hospitals and doctors from revenues. If medical institutions start suffering financially, supply of the healthcare could be severely affected. Not only supply is being affected in the US, but the demand is as well.
Would you say that demand for healthcare has changed during the recession? Wouldn't people prioritise their own healthcare over other consumption or other things they need to spend money on?
Not necessarily. The natural reaction of many people on the verge of unemployment is to prioritize, and in many instances, mortgage payments come before medical bills. Although some medical conditions occur whether this is a recession or not, and therefore will need to be treated straight away, such as Alzheimer's disease, heart disease, and cancer. However, people do seem to be changing their behavior regarding health. People have been putting off doctor's visit to avoid co-payments and other medical expenses. Also, fears of being laid off has meant that many people having elective surgeries moved up their treatment or surgery to make sure that it will be still covered by the employer-provided healthcare insurance. On the other hand, other people have been putting off surgeries as they fear losing their job if they take a long time period off work. Demand for healthcare has not been as affected in the UK, as people feel relatively secure about their future access to healthcare system and they don't have to pay for treatment.
So Neo, do you think these changes in people's behaviour are really due to the recession?
People in the US started to use the term elective care and adopted a strategy for wait and see. According to a July 2008 survey in 10,000 Americans, which focused on the recession of personal health choices, 41% said that they were making fewer visits to the doctor, 8% were having fewer elective surgical procedures, 13% were cutting back on their health insurance coverage, and 22% were buying less prescription medicines, and 16% said the recession affected other personal health choices.
So what knock-on effects could this prioritisation of other consumption over health have, do you think?
Well, from my perspective, the possible results are threefold. Primary and preventive care will be delayed, there will be more delayed payments for people facing high deductibles, and more medical institutions would go bankrupt. All these might have grave consequences in the long term. The recent economic recession seriously jeopardized the chances of finding borrowed capital at low cost in hospitals, already short-staffed, have no other choice than delaying future investments. Furthermore, since health cannot be purchased directly, healthcare is considered as a way of responding to the need of health. The effect of purchasing healthcare is often not apparent immediately, and in some instances it can only be seen many years later in life, so it is easy for some to view it as an investment, and disregard it in the face of more pressing issues as losing their shelter. However, this could result in more health problems further down the line.
Do you think the recession itself could have actually caused any health problems and therefore increased demand for healthcare during this time?
There is no question among healthcare professionals that a person's mental health impacts on one's physical health. More people have been reporting emotional symptoms and depression.
Xiaojing, surely having medical insurance should protect people against uncertainty. Isn't that its purpose?
Yes, ideally this is its purpose, but many people in the US do not have adequate health insurance. Additionally, if you lose your job, you will no longer have health insurance, and with recession comes high levels of unemployment. It is estimated before the economy fully recovers, 4.2 million Americans will lose their health insurance.
Now across to our special correspondent Seema, who will be talking to the director of the WHO Collaborative Centre in London at Charing Cross Hospital.
So what effects do you think the recession has had on global health?
Well, recession will have a lot of impact on global health in a variety of ways. I mean, number one, because of recession, the amount of money available for aid, from international organizations and huge charitable organizations will be less, and this will affect the development of various programs in many countries around the world, in particular those programs which has direct impact on people's health, for example, HIV infection in some of the African countries, and also it will decrease the opportunities, which is number two, for capacity development. As you know, many countries around the world depend on international support, which is mainly financial support, for their students to study in different parts of the world.